Hey everybody, Dr. Sajewicz here, your favorite radiologist. And this time I do have a cool case, teaching case for you guys. It's not an interesting type case where I see something I'm like, oh, I wish I could write that up and publish it or something like that. No, this is more of a teaching case and a lesson for CT technologists, right? This is something where I want you guys to be careful about going forward, all right? This is one of the, I guess, no-nos that techs can cause all on their own. This is something that's all technologist dependent, right? All right, well, before we get into the video, do me a quick favor and hit that like and subscribe button for me, okay? It really helps with the SEO traffic and gets my name out there so that other techs can find out about my free channel and get some free learning just like you guys. And now let's get into the case. Here we go. Okay, so this is a typical chest CT, right? We have some contrast on board. We have this cool little anatomic variant here where you have an aberrant right subclavian artery where it has this retroesophageal course, so it's coming across the chest and going towards the right shoulder. Another anatomic variant, you have this azygos vein coming across the lung like that, as opposed to kind of being more in the mediastinum. Here it's crossing lung tissue, so we call this a right upper azygos lobe. But that's not why I'm showing you this case. I'm showing you this case for this and for this stuff here. What is that? What is all this black stuff? I can change the windowing a little bit. What is all this black stuff layering here, right, non-dependently in the right ventricle? Yes, you guessed it, that is air. So how did so much air get into the right ventricle? So this is your dreaded air embolism, which can be caused just by putting in an IV, but putting in an IV, you just get a couple of droplets of air, right? A couple of little bubbles that doesn't do anything. There's no clinical significance, so there's nothing to worry about. But in CT, when you have a potential line from the injector all the way to the patient full of air, that can be a problem. If that gets injected into the patient, that can be a problem. All right, so that's the air embolism. And I wanted to show you what it was, and then I wanted to kind of give you the treatment. All right, so these patients that become symptomatic from an air embolism, they might get acutely short of breath right on your CT table. So it usually happens right afterwards. And so I guess you don't really know for sure if the patient is short of breath right after you give contrast. Are they having an allergic reaction, or was there an air embolism? So hopefully if somebody is monitoring, the injection, you might actually see the air going in and be like, oh, damn it, and you like hit the stop button. If you don't, well then hopefully you're looking at the images as they're coming out maybe, right? And you can see it in the heart, right? Techs should always be checking their work. I don't expect you to make a diagnosis on a chest CT, but you should be looking to make sure you covered the anatomy correctly or covered all the pathology. If there's a mass in the right lung apex and it goes into the lower neck, my techs already know ahead of time they have to go back and go a little bit higher and cheat a little bit going up into the neck to give me those extra images, right? So we don't have to bring the patient back again for a whole nother CT just to do a second bolus of contrast and a whole second dose of radiation. I mean, just go back and give me a couple extra images and I can make a better read on that chest CT. Anyway, so hopefully you're checking your images and you may have noticed, look at all this air in the right ventricle. Well, now what do you do? I mean, do you just freak out and call a code? No, we don't want to do that, right? You could call a radiologist. Okay, that's a great first option. And then what should the radiologist tell you? Well, the radiologist hopefully will tell you what you should already know, is that now the object here is to trap as much of that air as possible in the right side of the heart. And how do you do that? Okay, so you think about it this way. The air is always going to float towards the surface, right? If the air floats towards the surface, and let's look back at the image here, then since the air here is in the right ventricle, the patient laying down, what you want to do is prevent that air from going into where? into the main pulmonary artery. Some has already squeaked up there, right? Some air sneaked up into the pulmonary artery. You want to prevent as much air as possible from getting into main pulmonary artery, because then your heart could push it out into the lungs, and you could have kind of like an infarct, right? These air bubbles can lodge in the vessels and cause a pulmonary infarct. We don't want that. So, best bet here now is what we call what? You guys hopefully learned about this in tech school. Okay, so you guys want to do a Durant's maneuver. What is that? Remember, air's going to float away from gravity, right? So it's going to go up. You want to put the patient left-sided down, so left side of the cubitus. So that'll hopefully keep the air in the right side of the heart, in the right ventricle or in the right atrium, which is right over here, okay? And a little bit of Trendelenburg, okay? So a little bit of head-sided down. So patient laying on their left side down, and a little bit, if you can tilt the table to a head down procedure or a head down maneuver. We want to keep that air from going into the main pulmonary artery so that it doesn't get pushed out into the lungs. And then once you do that, then you could call someone for help. All right, so if you called the radiologist, hopefully they told you to do that. If the radiologist didn't know, well, then he should be fired. But as a technologist, you really should kind of know this stuff and how to treat an air embolism. Because after all, if you didn't check the line and you hooked up the patient and you injected him, well, then you caused it. So you should probably know how to treat this and then call for help. Anyway, so that's all I have for you guys today. Hopefully you got something out of that. I also wanted to let you know that I do have a free course available for you awesome CT and rad techs. It's called the CT SuperTech Starter Course. And to get it, all you have to do is go to my website, www.technologisttraining.com. So as it's written all out, technologisttraining.com. Or you can go to www.ctsupertech.com. And once there, all you got to do is give me a name and an email address, and you get instant access to this course. So, what is this course going to do for you? Well, in my opinion, it's going to make you become one of the most desirable and competent techs to work with at your institution. Okay, so I'm giving the course as a seasoned radiologist, and I'm giving you the secrets that I came up with, and I put it in an easy-to-remember two-step system. Okay, anybody can do this. Here's a fraction of what you'll see. How to differentiate yourself from all the other techs in your department, how to elevate your status and deliver exceptional patient care at the same time, and how to pick up on other people's mistakes and avoid harming a patient. Aren't those all great things? Okay, this is going to accelerate your career and have you skip to the front of the line and avoid doing years of traditional on-the-job style training. That sounds like a great win to me. So, just want to say thank you again for coming back to the YouTube channel and checking out the video, and we'll see you next time.